We've all been there. You get that annoying paper cut that stings way more than it should, or maybe a scraped knee from a clumsy moment. They seem like such a small part of life, but here's a question for you. Are you actually treating them the right way? Let's get into it. Right? That sudden, sharp sting from a paper cut, or the all too familiar grind of a scraped knee? We all know exactly what that feels like. But in that split second, what's the absolute best way to react to make sure it heals fast, clean, and safe? Okay, so first things first, you've got to know what you're dealing with. Is it a cut or is it a scratch? It might sound super basic, but trust me, knowing the difference is the crucial first step. It really dictates everything that comes next. So the difference is actually clearer than you might think. A cut, that's a deeper problem. It can slice right through the top layer of your skin and get into the fatty or even muscle tissue below. A scratch, on the other hand, is all on the surface. It only damages that top layer of skin. It doesn't break through to the deeper stuff. And usually the cause is your biggest clue. Cuts typically come from something sharp and clean. Think kitchen knives, razors, or even the sneaky edge of a piece of paper. Scratches, well, they're all about friction. Think rough surfaces like concrete or maybe an unfortunate run-in with your cat's claws. All right, so you've figured out what kind of wound it is. Now, what is your body actually telling you? It's time to learn how to read the signs, those immediate signals that your body's defense systems are already kicking into gear. Your body's alarm bells are going to go off almost instantly. You'll probably see some bleeding, you'll notice redness and swelling as your body rushes resources to the site, and of course, you're going to feel that unmistakable pain or irritation. These are the main things to look out for right away. So you've identified the injury and you're reading the signs. What's the next play? Well, this is your first aid playbook. The immediate, super important steps you can take right now, probably with things you already have at home. And here's the good news. Effective home care is actually pretty simple. It all boils down to 3 critical steps. Ready? 1. Stop the bleeding. 2. Clean the wound. And 3. Protect the wound. Let's break those down. First and foremost, you have got to control the bleeding. Grab a clean cloth or some gauze and apply gentle but firm direct pressure. This simple action is so crucial because it helps your blood start to form a clot and seal up the wound. Okay, once the bleeding has slowed down, it's cleaning time. And this is your number 1 defense against a nasty infection. The first thing you want to do is rinse the area with some cool, clean water. Then, for a deeper clean, to really get rid of bacteria, you can use something like ethyl alcohol or hydrogen peroxide. And finally, you have to protect that wound. A thin layer of antibiotic ointment with a fresh bandage over it does 2 things. It keeps dirt and germs out, and it keeps the wound moist, which actually helps speed up the healing process. Now, for most little nicks and scrapes, those 3 steps are all you're going to need. But sometimes home care just isn't going to cut it. So let's talk about the red flags, the signs that are telling you it's time to call a doctor. Knowing when to get professional help is so important. You need to see a doctor if you have a large, deep, gaping wound, or if a cut just won't stop bleeding after, say, 10 minutes of pressure. Also, watch for signs of infection, like if the pain gets worse, or you see more redness, warmth, or pus. And the difference in scale here is huge. Home care is the basics, bandages, ointments. But professional medical treatment, that's a whole other level. We're talking stitches to close a deep wound, prescription antibiotics to fight a serious infection, or in some cases, even surgery. And this is exactly why getting it right matters so much. Just let this sink in for a moment. In rare cases, an infected wound can be fatal. It's a really sobering reminder that even a tiny little injury needs to be taken seriously right from the start. Okay, so on that serious note, let's shift gears a little. We've covered what to do right when an injury happens. Now let's talk about the final steps, long-term healing, and even better, how to prevent these things in the first place. The best treatment is to avoid the injury altogether, right? And simple habits can make a huge difference. Things like wearing protective gear when you're playing sports or doing yard work. Just being aware of what's around you, handling sharp objects with care, and, maybe thinking twice before doing something risky. So what's the big takeaway here? If you remember just one thing, make it this: clean and treat any wound right away. It doesn't matter how small it looks. Taking quick, proper action is your best defense against infection and the absolute fastest way to heal. So I'll leave you with this last thought. Your skin is your body's first line of defense.
It works 24/7 to protect you. So when it gets compromised, are you ready to protect it in return? Thanks for tuning in.